A 62-year-old Caucasian woman was first diagnosed with chronic lymphocytic leukemia of the B-cell lineage in July 2002. She showed marked leukocytosis with a white blood cell count, WBC, of 43.35 times 109 per liter, 82% lymphocytosis, accompanied by slight anemia, hemoglobin 11.1 grams per deciliter, and a platelet count of 129 times 109 per liter. Flow cytometric immunophenotyping of the peripheral blood identified a CD5/CD19/CD20/CD23 positive clonal B lymphocyte population with kappa light chain expression. A chromosomal fluorescent in situ hybridization, also known as FISH, analysis revealed DEL 14q32. Upon this first presentation, the patient's general conditions were good. There was no peripheral lymphadenopathy or hepatosplenomegaly detectable. Hepatic and routine laboratory parameters were in the normal range. Plasma proteins as detected by electrophoresis and immunofixation were without pathological findings. Therefore, a watch and wait approach was chosen. Upon reevaluation in December 2002, a lymphocyte doubling time of less than 6 months was found. The patient had developed splenomegaly and cervical as well as axillary lymphadenopathy. The patient received 5 courses of chlorobutazil until May 2003 but did not show significant regressions of tumor lesions. Leukocytosis and non-hemolytic anemia further deteriorated, accompanied by a 10% weight loss. Platelet counts remained normal at this time. Administration of packed red cell transfusions was necessary. Fludarabine monotherapy was started in June 2003. After the first cycle, the patient developed fever, a secondary antibody deficiency, and a Combs-positive severe anemia without detectable hemolysis. In addition, protracted thrombocytopenia developed. The patient became transfusion dependent for erythrocytes and platelets. Upon immunoglobulin substitution, the therapy with chlorambucil was reassumed. Under the regimen, the CLL progressed to BINET stage C with subtotal bone marrow infiltration by mature lymphocytes with almost no residual hematopoietic activity. Bone marrow aspiration showed subtotal bone marrow infiltration with displacement of normal hematopoiesis. At this time, a combination chemotherapy was started. After the first cycle, the thrombocytopenia did not improve, and the patient experienced a retinal bleeding. Considering the remaining therapeutic options and the risks of any further aggressive chemotherapy in a severely cytopenic patient, rituximab monotherapy was started. During this therapy of intensified rituximab, the patient became transfusion-free. 12 weeks after the first dose of rituximab, anemia abated to a hemoglobin level of 9.5 grams per deciliter. Platelet count progressively rose and leukocyte count decreased. This regimen was sustained 20 times until November 2005. During this therapy, the hematopoiesis recovered completely with the hemoglobin level reaching 11.9 grams per deciliter and a white blood cell count of 4.38 times 10 to the 9th per liter and a platelet count of 1.38 times 10 to the 9th per liter. Both the lymphadenopathy as well as the splenomegaly regressed completely. Over the entire term of maintenance therapy, treatment of pulmonary infections by oral antibiotics became necessary 3 times but could be performed at the outpatient level. Prognosis: chronic lymphocytic leukemia of the B-cell lineage.